This is Texas Public Radio. I'm Jesse Brown, and you're listening to Magnificent Mavs. Today, we are excited to have Jaskirin Kaur with us today, a registered nurse from India who is advancing her career with a master's in public health. Jaskirin, thank you so much for being here today. Your topic, it's a great topic on home culture and how one's home culture affects one's belief of healthcare in their host country. Can you tell me about your experiences when you were growing up in rural India, and now that you're living in the United States, how you previously and currently view Western medical care?
Hello, Jesse. Thank you for giving me this opportunity to come and speak over this topic. And I'm really excited to dive into a topic that's been a really big part of my journey, like how cultural beliefs shape healthcare, especially in the rural communities where I've been from. So, absolutely, like growing up in the rural India, healthcare was often a family affair. Like, we had home remedies for nearly everything, like neem leaves, turmeric, and ginger. They were seriously a part of our toolkit. And visiting a doctor was like a last resort until it was something really very serious. And in the US, I have noticed that people rely much more on professional medical care, even for the routine issues. And it's a really shift for me. I've learned a lot about the value of preventive care, which is less common back in my country. But I've seen here is that health is focused more on the preventive care. That was new to me, and it has shown me the strengths of each approach and the importance of bridging the two gaps.
That's excellent. Thank you. I know that in my limited understanding of India, India has this incredible background of having the oldest surviving medicine known to exist, Ayurveda. It's some 5,000 years old. For followers of traditional Indian culture and medicine, what is the perception of Ayurvedic medicine in conjunction with traditional Western medicine, but specifically diabetes?
In my experience working in India, Ayurveda was highly respected for treating chronic conditions like diabetes. And Ayurveda may see diabetes as something that can be managed by balanced diet, exercises, and making some certain lifestyle practices changes. So it's not just seen as a disease, but as a sign of some imbalance in the body, which can be corrected. And while Ayurveda has insights on diet and lifestyle, it doesn't always address the severe complications of diabetes in the same way that Western medications do. So there's a blend. Some may prefer Ayurveda to prevent or manage diabetes in the early stages, while others turn to Western medicine when complications arises. So
Thank you. In your research, the various home cultural beliefs outside of India, how do they align in better harmony with their individual medical problems? I know turbulence sometimes arises when those beliefs are mixed with Western healthcare. So, can you talk a little bit about the research you've done on traditional cultural medicine and traditional culture with Western medicine?
Yes, I would say that I have seen this firsthand. Like in many places, people trust their own traditional practices for managing health, and they work well with their own cultural context. But for example, some communities trust herbal remedies or spiritual healing practices that align well with their values and beliefs. But when these are mixed with the Western healthcare, then complications do arises. Like there can be misunderstandings, especially when doctors might dismiss these practices. So that can resistance or disturb. So finding a balance or mutual respect between these two systems could really make a big difference.
I believe this cultural belief, especially like you mentioned, with many individuals have a stronger belief of the spiritual practice. I see that a lot in the United States as well, with followers of a more traditional, conservative, evangelical Christian approach, where prayer is so important, but it often seems, especially myself, as I'm also a nurse, uh, sometimes, prayer is a wonderful component, but not solely at the expense of, as a nurse and in the intensive care, where at the expense of other medical approaches. Does that make sense? You mentioned how not yours, but beliefs in India, it seems very similar to the beliefs here in the States.
Yeah, that's really interesting, and I agree. Like, just like in India or other places, people in United States sometimes prioritize their beliefs over medical advices, and for some, it can be prayers or spiritual practices are the central approach to their health. And in my experience, I think people are more often comfortable with what they know and they trust. So I think it's crucial to respect the beliefs while also encouraging patients to seek the value of combining their faith or traditional practices with other medical care whenever necessary.
Hmm.
So even healthcare professionals should, respect the beliefs, the traditional beliefs of the patients, but on the other hand, the patients should also go and seek some medical advice and that professional care whenever they need. So
Hmm.
it's not only like they should be involved in that, traditional remedies or spiritual prayers. Being a registered nurse back in my country, even sometimes I prefer my patients that okay, if you don't want to go with that this particular medical care, it's completely fine, but don't completely rely on your home remedies or something like that. So yeah.
Yeah. Do you believe the perception and understanding of diabetes among minority populations, especially in rural India, if those who are struggling with diabetic complications seek care by a more traditional Western medical approach, their perception of that medical care would be improved if their native language was being utilized? Do you think that there might be a language barrier?
Yes, definitely. I think like language can be a huge barrier, especially in this complex cases such as diabetes. So, if doctors in rural India or even among Indian populations abroad can speak the local language, it can build trust. And when people understand that their treatment in their own language, it's like they feel more connected and confident in the process, and it also shows some respect for their culture. And even talking about my own experience, when I used to work in rural communities in India, and uh, English is not the native language there, so but we as healthcare professionals were supposed to interact with each other in English. And so the people over there, the patients who come to seek the treatment, they find it very difficult to interact with us. So sometimes we have to leave, our professional, some protocols to speak in English. We have to forget about it and talk to in the native languages like Punjabi or Hindi with the patients. And what I feel is that they feel more comfortable, and they can trust you well if you they feel more connected with you, and it helps them to seek better treatment so in their local languages. So yes, a language is a great barrier, I think so.
Certainly, certainly. I know at the beginning you mentioned, neem and turmeric and ginger. I myself use all of those
Yeah.
often in my diet and in my, tisanes that I brew at home. But there's such a large component of diabetes is diet related. Were you able to identify any evidence of an increase in diabetes as India has become a more westernized country, now the most populous country in the world, just very recently in the last few months? I know when I was in India last year, I had the opportunity to go to one of the malls in Delhi, and I was shocked to see how very Western this mall
Yes.
was.
Mhm.
There were like Abercrombie and Fitch and Taco Bell
Mm.
and an ice skating rink, and it was very very neat to have that experience be my last night in India, whereas I got the chance to see so many different experiences and opportunities while I was there, and only experiencing such a small amount of India. But do you feel with the expansion of a Western diet and a Western approach to life, diabetes has expanded in India?
So here I would say that in India, like it's been only a year when I'm here in United States.
Mm.
So I have spent like 24 years of my life in India, and even there everybody tries to be more westernized, like following the Western culture, the food and all that. And even yeah, the sugary drinks and all the processed foods, this is like children get up in the morning, okay, no diet, no exercise, nothing, no gyms. The very first thing which even I used to do is go in the kitchen and had one like a coke or anything like that. Whole day we are consuming that stuff. We're going out to colleges and schools, and children are just eating all that processed foods. And like what I observed is that diabetes, like it's more higher in children's than in the older adults.
Mm.
So it's just because of the westernized food. Yeah, I agree that we should become more advanced and like we should like grow more, but that doesn't mean that to adapt all of the complete western cultures like western foods too,
Absolutely.
because it's impacting our health. So yeah, I do believe that western food habits and urban lifestyle has increased the diabetes rate. And this change is especially noticed in the in the urban areas, but now it's also spreading very rural, like the rural communities also. So I think this is something which healthcare providers should try to address with their education, but in local languages and preventive care. So
Uh, when you were a practicing nurse in India and your research since you've left, do you feel as though there is a general acceptance of the diabetes diagnosis, or are the predominant rural Indian communities, are they more doubtful of the diagnosis altogether? And if so, if there is that doubt or perhaps lack of understanding, if there was an Ayurvedic practitioner or the local doctor there who is more in line with that cultural belief of life that they do in that community, but they also advocate for a Western medicine approach, does that seem to be more harmonious? Do they seem to complement better? I know that was a lot to ask.
yeah, but I think it's a mix of both. Like in some areas, there's definitely still some doubt about diabetes, and it's not that people don't understand the term, but they may not fully recognize the severity until the complications occur. So, and are unsure about what to do in that scenario then. And I've seen Ayurvedic practitioners who work alongside the Western medical providers, especially for the preventive care, and they might recommend the lifestyle changes and the dietary patterns that align with Ayurvedic principles. So, but they refer patients to a doctor when stronger interventions are needed. Only when like a patient says that no, nothing is working, not the diet and the remedies, nothing is working. Then the Ayurveda practitioners like refer them to okay, then I think you must need a complete medical care from a perfect health professionals. So according to me, it's a very collaborative approach, I would say. So people go to hospitals to seek medical advice or care only when they're at at the worst. When all the complications are like surrounding them, only then they go to seek the health care. So,
No, I understand. Thank you. I know in this country, I've been a nurse and a paramedic for maybe 14 years now, and culturally competent care has been something that has been talked about a lot in my training and in my schooling from different professions, from as a on the ambulance to in the hospital. Culturally competent care, you hear that so much. Uh, do you feel that this approach has been having positive results um, with with the emphasis on healthcare providers in this country performing in a more culturally competent approach to the care of their patients?
Yes, like absolutely, cultural competence is really essential in healthcare. And in my research, when healthcare providers show respect for patients' belief and traditions and try to understand their background, patients really respond better. And it makes them more likely to follow the treatment plans and trust the provider who's providing care to them. Even something as small as being uh, open to the traditional remedies without pushing them aside, I would say, and can make patients feel heard and respect. And when you're doing that, your patient blindly trusts you, and whatever you whatever you're providing them to do for their betterment of health, they do rely on you and completely trust you when it comes to competent care and that. So
What suggestions do you believe would best encourage a even broader, more culturally competent engagement with Western medical healthcare compliance? How could there be a continued improvement from a more harmonious approach to healthcare in this country to those coming from other countries? Whether it's rural India, Africa, South America, how do you think that we can continue to move in a more appropriate, complementary fashion?
I think it's important for both the healthcare providers and the patient to contribute to better understanding. Like the best start, like talking about rural India, first of all, the best start is educating the healthcare providers about common beliefs in the community which they are working and like in the community they are serving. Simple things like learning the basic phrases in the local languages or understanding the common health practices and the traditions of their area. And also, the patients should openly communicate about their tradition, about their culture, and the preferences, and be open to discuss how they can integrate their beliefs with modern healthcare. And and the topmost thing I believe is the mutual understanding and the trust which should be there in a healthcare provider and the person who is there to seek medical care. So yeah, that's it.
No, that this has been very helpful. Thank you. If there's one more thing that you would want our listeners to remember, what would that be after this conversation today?
I want listeners to remember that health is deeply personal and shaped by our cultural background also, and it's essential for both the healthcare providers and the patient to engage in an open, respectful dialogue about the cultural beliefs. And by blending the strengths of traditional practices and modern medicine also, we can create a more, I would say, inclusive and effective healthcare system that truly supports everyone's well-being. So at last, I would say that let's embrace cultural understanding with work together for the better health outcomes.
I love it. That's fantastic.
Thank
Thank
you.
you so much for coming today and speaking to the audience. And I look forward to see where this conversation continues to advance. Thank you so
Yeah, sure.
much.
Thank you so much.
Bye-bye.
Thank you.